Hi, I'm Lieu from the University of Colorado. I'm a GI medical oncologist. All right, so I'd like to talk to you about a terrific responder to treatment for hepatocellular carcinoma or liver cancer within my practice. So when you talk about hepatocellular carcinoma, and if I ever say HCC, that means hepatocellular carcinoma. This is the most common type of primary liver cancer that we deal with in cancer medicine. When you look at the statistics for liver cancer, the incidence has actually more than tripled since 1980. And the rate actually continued to increase by more than 2% per year in women from 2013 to 2017, but is relatively stabilized in men. When you look at the risk factors for liver cancer, it includes anything that causes what we call long-term inflammation or anything that can really scar down the liver. And when we think about what some of these risk factors are, we think about hepatitis B, hepatitis C, and heavy alcohol intake can do this as well. Interestingly, approximately 70% of all liver cancer cases in the United States could actually potentially be prevented through the elimination of risk factors. And what are some of those risk factors? Obesity, type 2 diabetes, hepatitis infection, just reducing alcohol intake and or smoking. But interestingly, some evidence actually suggests that drinking coffee may actually reduce your risk for liver cancer. So that's always kind of a fun research to talk about. The therapy and sequencing of therapy for liver cancer is changed dramatically in the past 3 to 4 years. When you think about the treatment of metastatic liver cancer from 2008 to 2017, there was actually only one FDA-approved therapy for advanced hepatocellular carcinoma or liver cancer, and that drug was called sorafenib, a pill. Since that time, there are now over 9 treatments or regimens that are available for use in hepatocellular carcinoma through different lines of therapy. And so interestingly, when we think about metastatic cancer, we think about using systemic chemotherapy. That's what the first thing that everybody kind of comes to mind. But this has never been shown to improve overall survival for patients with hepatocellular carcinoma. So most of the research for treatments for liver cancer are really focused on targeted therapies and immunotherapies. So one of the major breakthroughs in cancer medicine over the past 20 years has been the development of targeted therapies, where drugs are used to target cancer cells using a type of smart bomb versus chemotherapy, which we can kind of think of as dropping an unguided bomb, where you may hit your target, but you get a lot of collateral damage to these areas, which in the human body, that of course would be normal, healthy tissues. The other major breakthrough that has made a lot of major headlines has been the use of immunotherapy for patients with cancer. And these are drugs that try to get the human immune system to recognize and fight the cancer for us. So interestingly, the combination of targeted therapy and immunotherapy has proven to be effective for patients with hepatocellular carcinoma. Atezolizumab is an immunotherapy that tries to break a stop signal from the tumor to the body's T cells or immune cells to prevent it from being attacked. We call these immune checkpoints because the immune system is told by the cancer to stop and not kill it. Atezolizumab is an antibody that breaks this signal and hopefully turns that stop signal into a go signal. Bevacizumab is a drug that targets tumor blood vessels. And for a tumor to grow more than a centimeter, it actually has to grow its own blood supply, like a tree grows its roots. And bevacizumab basically tries to prune the roots of the tree to get the tree to die. So interestingly, in 2020, the IMbrave 150 study provided the results of a combination of an immunotherapy, atezolizumab, and bevacizumab, that targeted therapy that targets tumor blood vessel growth. And they compared that to sorafenib, which is the standard of care drug at the time for patients with untreated advanced metastatic hepatocellular carcinoma. And the result was a significant improvement in overall survival in patients who are receiving the immunotherapy and targeted therapy combination. So I personally had a patient, a 50-year-old male that had liver cirrhosis and had developed hepatocellular carcinoma. At the time of diagnosis, the patient's tumor had spread to other areas in the liver, but also the lungs as well. And so therefore, when we met the patient for the first time, he was diagnosed with metastatic or stage 4 liver cancer. Given that surgery and radiation were not treatment options, we started our patient on the combination of atezolizumab and bevacizumab, that immunotherapy and that targeted therapy. And after just 3 doses of this treatment, all of the tumors had actually decreased by 50% on his first CT scan since starting treatment. After 1 year of this treatment, all of his lung tumors are no longer visible, and the tumors in the liver are about 20% of the size from when we started. And of course, the best part about this is that he's tolerating the therapy really, really well with fairly minimal side effects. So while this treatment may not work for everybody, in a certain percentage of people, this combination treatment results in an exceptional response. And when that happens, the benefit can be profound. And almost more importantly, the treatment effect is durable. And what that means is that the benefit is not temporary. It doesn't last for a short amount of time. Instead, it looks like it's lasting for a very long amount of time. Of course, in the future, we hope that we find personalized therapies for all of our patients with cancer, because we do want to provide outstanding results for everybody. But it does show the promise of what some of these medicines can do. Thank you.